Welcome to my Medicare 101, and thanks for taking the time out of your day to join me. Today, my goal is to make sure you better understand the Medicare options available to those who qualify or who are about to qualify for coverage. Hopefully, after the end of the presentation, you'll feel more knowledgeable and confident in the direction that you may be choosing for yourself or for someone that you know. Let me start by telling you a little bit about myself and my credentials. My name is Erica Huffstetler, and I reside in a town called Globe, Arizona, where I'm licensed in Arizona, Texas, Ohio, Florida, and South Carolina. I'm appointed with most major insurance carriers, including United Healthcare, Cigna, Aetna, Blue Cross Blue Shield, Devoted, and Anthem. Before we begin the actual presentation, let me take a few moments to review some key terms. These may be familiar to you, but I want to make sure we're all on the same level, so we're using the same terms. First is beneficiary. This is how individuals covered under Medicare are referred. So if you have Medicare coverage, you are referred to as a Medicare beneficiary. This is a very common term that you will see on government and Medicare information websites. The next term is premium. A premium is the bill that you pay, usually monthly, to have coverage. This is a fixed cost once you have coverage. Premiums may go up when you renew your coverage, but once you have the coverage, your premiums will stay the same until renewal. Most of you may be familiar with the term deductible, but this is a preset fixed amount that you pay out of pocket before insurance begins to contribute towards your medical expenses. A copayment or copay is also a preset fixed amount, but it is applied to a specific service or product. For example, a plan may require a $30 copay for a doctor's office visit. Coinsurance is the sharing of costs, usually a percentage, between you and the insurance plan after you have paid the deductible. So once you pay the deductible, you may be responsible for 20% of the covered charges and the insurance pays the other 80%. We are going to learn about Medicare through Joan's experience today. Joan is 64, preparing for retirement, and plans to enroll in Medicare when she turns 65. Like many people new to Medicare, she doesn't know a lot about the program. She knows it's a federal health insurance plan that started in 1965 as part of the Medicare Act. She knows that eligibility includes those aged 65 and older, those under 65 with certain disabilities, and people with end-stage renal disease. And she will get a Medicare card for that as well. As a highly motivated self-starter, Joan logs onto the internet and does an initial search to find out more. Joan always thought that Medicare was a single medical plan, but it actually has 4 parts, A, B, C, and D. She learns that Part A covers her hospitalizations, skilled nursing, and some healthcare services and hospice. Part B, she finds out, covers her doctor visits, preventative care, diagnostic testing, and durable medical equipment, such as braces and wheelchairs. Part C is also known as Medicare Advantage, which Joan has heard of, but she isn't familiar with. And Part D is for prescription drug coverage. She also learns that Parts A and B are known as Original Medicare. Joan needs to figure out if and when she qualifies for Part A. As long as she has worked 40 quarters or 10 years or qualifies under her spouse's benefits, she can get coverage. Otherwise, she will need to buy into Part A. Since Joan has worked her entire career, she will qualify under that provision. She's heard that Medicare can have some significant gaps in coverage. For example, her Part A deductible of $1,600 will cover days 1 through 60 of a hospitalization. However, if she had an extended stay, days 61 through 90 have coinsurance of more than $419 a day. Should she have a catastrophic situation, days 91 and beyond will cost her $838 a day, up to 60 additional days over the life of her coverage. Skilled nursing has an additional out-of-pocket. Joan finds out that Part A provides 100 days of coverage, with days 1 through 20 having a $0 coinsurance. However, days 21 through 100 have a daily copay of $204. So Part A covers her for hospitalizations and other inpatient services. Joan then learns more about Part B. Apparently, she has to pay a $206 monthly premium for Part B, but that will provide her medically necessary services for outpatient services like doctor's visits or outpatient diagnostics, and her preventative care like a mammogram. So she has to pay a monthly premium, and she also finds out that there are additional out-of-pocket expenses that she can face. There's an annual deductible of $240, which is followed by a 20% coinsurance that she'll be responsible for. Additionally, in most states, providers who don't accept Medicare payment can charge an excess fee of an additional 15% of the total to balance bill. Not surprisingly, like all insurance, Medicare doesn't cover everything. She has a moment of panic when she sees that Medicare doesn't cover her prescription drugs. But then she remembers that self-administered medication is covered under Part D. That leads her to another search. How does she get Part D, and what could that cost her? It turns out that prescription drug plans under Medicare are offered through private insurance companies. To get coverage, she has to be enrolled in Part A or B, and she can face a penalty if she waits too long to enroll. She also finds out that she has options. She can buy a standalone drug plan known as a PDP or prescription drug coverage that could be included with Part C Medicare Advantage plan, and there would be a deductible to apply. But the drug list or formulary is based on a tier system. The higher the tier number, the more out of pocket. She finds out that she could probably expect to pay between $15 and $100 a month for all Part D plans have the same general structure starting with the deductible. Joan knows how deductibles work, but there are other stages that are completely foreign to her. There's the initial coverage period followed by the catastrophic stage. Let's do some research. So, during the deductible phase, Joan is responsible for 100% of the retail costs for her prescriptions up to $615. Once her deductible is satisfied, she enters the initial coverage stage where she will pay 25% on covered drugs. There's no fixed spending cap. Instead, this phase continues until your true out-of-pocket spending reaches the catastrophic coverage, which is $2,100. and the Part D plan pays the remaining balance. The plan will track the total amount paid by Joan until she reaches 2,100. The plan will only track her expenses during the initial coverage phase. When she clears the initial coverage, she will move into the catastrophic coverage stage. During this last stage, Joan will be responsible for 0% coinsurance, and the remainder will be paid by the plan for the remainder of the year. This all gives Joan a lot to think about, and to be honest, it leaves her concerned. In fact, an extended hospital stay or serious illness could ruin her retirement plans, even with coverage through Medicare. She needs to find out if she has options to protect herself against all of the potential out of pocket expenses. Joan remembers that her friend Diane enrolled in Medicare when she turned 65 last year. When Joan calls her, Diane explains that she purchased a Medicare supplement plan, sometimes called MedSup or a Medigap plan. These plans, Diane explains, are sold by private insurance companies to work with original Medicare Parts A and B. According to Diane, her MedSup helps cover the gaps left by Parts A and B, like deductibles and coinsurance. Diane had to buy a separate Part D plan since prescriptions aren't covered by MedSups. Joan asks if she knows about Part C Medicare Advantage, but Diane explains you can have a MedSup or Part C, but not both. Please take a moment to review this table and the variety of plan types available. Joan feels a lot better after talking to Diane about MedSups. Before they hang up, Diane tells Joan to call their former coworker Phil. Phil has a Medicare Part C Medicare Advantage plan and can tell her how that could be an option for coverage. When Joan calls Phil, he tells her that she can get a Medicare Advantage or MA plan from any number of private insurance companies. Medicare Advantage plans include all of Parts A and B, and some plans include Part D coverage for prescriptions, known as MAPD. These plans may also have additional coverage for things like hearing, vision, and wellness and more included with the plan. To qualify for a Medicare Advantage plan, Joan needs to enroll in Medicare Parts A and B, live in the plan's service area, and she cannot have end-stage renal disease. In a search for plans in her area, Joan finds that most of the plan options are HMO and PPO plans. Regardless of her choice, she has to maintain her Part B coverage, and most of her services would require a copay or coinsurance, kind of like her plan through work. She also finds that many plans have a low or a $0 monthly premium and have a maximum out of pocket to reduce the risk of major bills. The HMO option will require that she gets all of her non-emergency care from network providers, and her care will be coordinated by a primary care physician. Her primary care physician will refer her to any medically necessary services that may be required to get some prior authorization from the plan for those services. The PPO plan options provide coverage for both in and out of network providers, and it doesn't require a primary care physician. These plans would provide more freedom of choice since referrals are not usually required. Cost may be a concern for Joan. With a Med Sup, she'll still pay her Part B premium along with a monthly premium for the Med Sup coverage. However, she'll have little or no out-of-pocket costs when using the plan. She also has to pay her Part B premium with a Medicare Advantage plan, but those plans usually have a much lower or even $0 premium. But when she could have copays and coinsurance when she uses the plan. A Med Sup would allow Joan to use any provider who accepts Medicare, which would give her a lot of flexibility to get care. Medicare Advantage plans have networks that would limit which providers she could use. Even with a PPO plan, if she goes out of network, she'll face higher costs. Joan sees how a Med Sup would be a good fit if she wants to travel a lot and wants the freedom to see any doctor accepting Medicare. If she needs a lot of health services, she may need to figure out how to budget for the higher premium Med Sup plan. She will have to buy a standalone Part D plan with a Med Sup, but she might be able to find a Medicare Advantage plan in her area that includes drug coverage. Joan has a lot to consider before enrolling in Medicare. She's not sure what she'll do yet. She could take original Medicare Parts A and B, consider a Medicare supplement plan, and then purchase a Part D plan to cover prescriptions. Or she can roll in a Medicare Advantage plan. She might find one available with Part D coverage included. But if she doesn't find one that includes Part D coverage, she will need to add a standalone plan. She remembers that she can only choose a Medigap plan or a Medicare Advantage plan, but not both. To get some more information, Joan attends an educational seminar to see if there are other ways that she can save on her Medicare expenses. First, there's Medicaid, which helps pay some of the costs not covered by Medicare. Medicaid may also provide some benefits that are not covered by original Medicare. Then there are Medicare savings programs. If she qualifies for one of the programs, she can use those funds to help pay for Medicare Part A and B costs, like her premiums, deductibles, copays, and coinsurance. Extra help or low-income subsidy helps pay for Part D prescription costs such as plan premium, deductible, coinsurance, copays, and coverage gap expenses. Finally, she learns that there may be additional resources through a state pharmacy assistance program and even through drug manufacturers that offer patient assistance programs. Along the way, Joan learns that she cannot get Medicare coverage anytime she wants. When her 65th birthday gets closer, she can initially enroll during the 3 months before, the month of, and 3 months after her birthday. Also, each year she can make changes to her coverage between October 15th and December 7th. This is known as the annual enrollment period, or AEP. That's probably when she starts seeing all of those commercials on TV. She can also make a change if she has a qualifying event or recognized life change outside of AEP, like moving to a new area where her plan no longer participates. To find out more about Medicare, visit Medicare.gov or call 1-800-Medicare. You can also visit the Social Security website or call 1-800-633-4227. Thank you.